Hello and welcome to HealthLive at Seniors Today. We are delighted to have here with us once again Dr. Prasanna Shah. Dr. Shah is a leading consultant interventional gastroenterologist and is attached to the Breach Candy Jaslok and Saifee Hospitals in Mumbai. He has vast experience in therapeutic endoscopy and now metabolic correction endoscopy for weight loss. We are delighted to have you here with us, Dr. Shah.
Thank you, Pradyuman, for having me back on Senior Live. I would like to thank also Mr. Vikram Sethi for this opportunity, which we are talking of a rather vintage problem, if I may say, of acidity. And so therefore, it's good that we're going to be discussing acidity. To come to the current scenario, our pandemic, are we in a good phase or are we in a bad phase? Are we turning the corner? I think we are in between. We are doing well. We have to expect something in the just around the corner, but I think we are settling down well. And a good marker for that is our hospitalizations because of COVID have definitely come down. Our 80% of beds have opened up for non-COVID patients. So which is a good sign of recovery, I would say. Keeping in mind, yes, one can go out, but you have to adhere to the norms which have said social distancing, wearing a mask, constantly sanitizing your hands, avoid touching your face very frequently. So these things can be done. Avoid crowded places. Now in a place like Mumbai, I really don't know how much one can avoid doing this, but if it is absolutely essential to go out, then only go out. Otherwise, please stay at home. I would say people above 60, I think your hiatus at the house will still remain. I don't think you all can still go out. Please be careful, stay safe, stay indoors. That's my only plea and humble request to everybody in Mumbai and across India.
Thank you. And we'll take questions right away because there are so many questions. There are so many people who have registered. We have a question which you kind of answered before everybody came in. Was how long do you think Corona will last? COVID-19 will last? Will it be COVID-20, COVID-21?
We are now all awaiting the vaccine. So the vaccine should probably come between January and March now. By the time they're delivered to all the people across, vaccinations are taken place, the schedules are put in. I would be looking at October 2021 up to end of 2021. But I think it is important to remember that the severity of this problem has come down and we are slowly turning the corner. So there's no need to panic. Yes, await the vaccine. That should be it.
So we have questions which have come in. Some of them I came by mail, so I shared them with you, Doctor, earlier. So the one question is from Ashish Ranjan Sinha.
Yeah.
Is I have been burping and belching for the last many years. This happens particularly during my daily walk and also when I get up in the morning or when I'm tensed up for some reason. Have been taking PAN 40, which gives only temporary relief. Kindly help with a permanent solution.
So I think let me tell this to everybody before I start. What is acidity? What is bloating? What is gas? What is belching, flatulence? So acidity basically is acid which is produced in the stomach. And if that becomes too much, can cause symptoms. All right. There is an inflammation in the lining of the stomach. Now, there are many causes of acidity, and I'm not going to really get into that because that really needs to be discussed then. Gas and belching. Belching is an involuntary reflex where one emits air from the stomach. It goes through, and because it goes through it goes beyond the cricopharynx. Our voice box comes in between, and it reverberates the voice box, and therefore you get a noise. All right. So it can be passive belching. It can be forceful belching. Then nausea, vomiting, and bloating. Again, that's gas formation. Many reasons for this. Now, Ashish, your problem is mainly lifestyle. When I'm talking to everybody regarding acidity, bloating, gas, this is all comes under lifestyle changes. One has to very strictly change lifestyle. Means you have to avoid acidic foods and incorporate a lot of exercise in it. Your PAN 40 is good, but I would say look at your diet, look what you're eating at, and your exercise regime is also fine. I would say that you have probably what we call as acid peptic disorder. You have stress. That might be, you might be having stress, which we really don't know. I don't know your full history. So if you are stressed, obviously there's going to be more acid, and that's going to create more problems. You need to investigate, and we need to investigate something for H. pylori. It's called Helicobacter pylori infection, which comes through contaminated food and water, and it resides in the stomach. It's a very smart bacteria. It can reside in the stomach, and therefore it can cause gastritis, duodenal ulcers, and gastric ulcers. It can also cause cancer in the long run. WHO has classed it as class 1 carcinogen. So therefore, it is important that if you have all these symptoms, and if you are not responding to the normal PPIs, that is a proton pump inhibitors, because they produce the acid. So we reduce the acids by suppressing the PPIs, okay, or H2 receptors. So these are two, it's a little technical what I'm trying to tell you, but this is from where the acids come from, okay? So we give these medicines. If it's still not coming around, you need to investigate further. Ashish, that's all I can tell you at this moment.
Doctor, do you think, through your years of experience, do you find that the number of people complaining of acidity and gas, etc., has increased in the last 5 odd years?
Yes, it has. It definitely has increased. And as I said again, it is all got to do with our lifestyle. We have kind of, our lives are jailed in our mobile phones, and we've become couch potatoes. So we need to really have some me time, and we really need to get away from all this. So get out, do regular exercise, watch what you're eating, because a slip on the lip is a lifetime on the hip, as they say. So, you have to be careful. And therefore, lifestyle changes and dietary modifications are important. That's my big take-home message.
We have a question from Mrs. Saras Gupta, and she is a patient of yours. A shortcut to taking advice from you again through this program, but happy to do that. She says, I'm taking
Espimisan Gold.
Espimisan Gold and Rezo 20 for last 1.5 years after meeting you last in Mumbai. Both the medicines are helping me. Can I continue these forever?
Yes, you can continue them for a long time till you come and see me. I think that's the best way I can, tell her.
Right. We have a question from Sampath Kumar Jagannathan, who said, I'm 60 and a vegetarian. Lost nearly 10 kgs in the last 1 year. Done all tests and looks normal.
Well, Mr. SJ, I think I'll call him SJ. I'll not take names. That will be better. So, Mr. SJ, all I can say is if all your investigations are looking normal, I would like to have a look at the investigations, because if you're losing weight, obviously there is something wrong. Either you're not absorbing, or you cannot digest. You've got maldigestion or malabsorption? Very difficult to say, but you need to be investigated. You have to do your thyroid profile also, and see, because that can be another cause of weight loss. Need not just be GI issues. If you're stress can be another very big a factor for weight loss. So the only thing I can tell you is eat nutritious food, have a good protein intake, and regular exercises, and try and take off the stress as much as possible. Hopefully you should start doing better.
We have a few questions which are pan 40 oriented, the question, but I'll ask them.
Pradyuman, I have a few questions which even I can see, so I can quickly just answer them. So, Mr. N.N. Ravindranath has just written in, and he says that he has a peculiar problem. Both his nose get clogged after taking food. And that's one of the very important signs of an extra-intestinal manifestations of GERD or reflux. GERD is gastroesophageal reflux disorder. And therefore, what happens is the acid comes up, it hits the throat, it causes sinusitis, and that phenomena is called LPR. It's called laryngopharyngeal reflux. It's a severe form of GERD. I would say it in a very simple parlance. So yes, Mr. Ravindranath, they are connected. Kindly have a look at that. Or look at allergies. You might be getting allergic to certain foodstuffs. So you need to look into that. Then Dimple has also written, is the chest bacterial infection is in the air? I really can't understand what do you mean by chest bacterial infection is in the air. Do you mean the H. pylori or do you mean the corona? I'm a little confused here. So I really cannot tell you this. Uh, we another have one from Mrs. Chandru saying that she wants to switch to homeopathy. But what medications are you taking initially, Mrs. Chandru? Please, you need to tell us that so I can tell you whether to switch to homeopathy or not. And very honestly, I really don't know anything about homeopathy. Though it's another science, it's a wonderful science. I have full respect for that. So, hey, you can go and you can definitely try it there. That's all I can tell you. The other questions which I'm getting from Mr. John is, in spite of my mother-in-law aged 84 having antacids, she continues to get gripping stomach pain and gas coming up and giving her a choking feeling. Any natural ways to curb it? I think, John, she might be having what we call as an irritable bowel syndrome, and therefore she's having these constant problems. I think you need to reduce the fiber if she's taking too much fiber, increase the fluid content. You've not told me whether she's diabetic or non-diabetic, because certain medicines also can cause some certain problems. So I need a little more histories for that. The foods which generally cause a lot of bloating and a lot of gas and all is, sometimes people cannot digest rice, carb indigestion, so they can bloat a lot. That's one. High contents of lactulose, that can also cause bloating. Three potatoes, that is starch, that can also cause bloating. So avoid all this, and hopefully, things should be better. That's what I can say. I think Shivangi's also written that she's tested positive 2 weeks back. So sorry to hear that. She has a lot of chest congestion, which is causing breathlessness. This becomes worse at night, but oxygen level is perfectly fine. Is there any chance this is a gastric issue? I'm a 24-year-old female. Okay, I will address this problem. You'll have to check whether, you've not told me whether you get burning in the chest or no burning in the chest. That's one. Two, it could be a gastric issue. I think recover completely. You might be a lot of, on antibiotics or something of that sort, and that could be causing gastritis. I think let us just recover after, give it another 3 more weeks. And if you're still not better, then you can give us a shout, Shivangi. No problem. We can help you out. Go ahead, Pradyuman.
Yeah, so I'm going to get into some questions that were posed to us earlier.
Yeah.
This is Hina Gadoya, who said, during the lockdown period, I got hyperacidity problem because I felt alone in the house and I used to get tense. While I was suffering from acidity, I felt pain continuously in my throat. I preferred not to eat anything except khichdi, as any other dish would result in acidity and I get vomiting. I was taking the following medicines for 3 months as prescribed by the doctor: Pepsia D for 60 days, Pan 40 for 3 days. These medicines relieved my acidity, but if I missed my dose, then I would feel the pain in my throat because of acidity. After the ENT specialist suggested me Revlimid and Revlimid D for a month, but after all this, sometimes I still feel a pain in the throat. Please suggest a solution.
Yeah, so Hina, this is, you're typically you're refluxing. And why you're refluxing, we really need to know. So you will require an endoscopy. And so we can, get to the root cause of it. That's the thing. And with an endoscopy, we will know whether you have H. pylori infection or not, whether you have a small hiatus hernia or not. So basically, in all, in a nutshell, all I want to tell you is that you need to be investigated, and you'll need to get an upper GI endoscopy in any of these regular hospitals.
We have two questions that are similar. One is by Armina, who says, who asks, how does one get rid of acidity and heartburn? What are the symptoms of acidity other than nausea? What should one take during an attack of acidity and heartburn? Then there's a question from Malcolm Montero, who asks, what is the cause of hyperacidity and heartburn, and how do you prevent this from happening?
So I think, both the things, I think both the things, one thing is certain, they're all lifestyle. Both are lifestyle disorders, both are lifestyle diseases. So check your diet, what you're taking. Another thing is food allergy. See what you're allergic to, because sometimes when you're allergic to certain foods, they can produce a lot of acid. So therefore, you need to keep a check on what you are eating. Basically, eat small portions, eat frequently, don't have late night meals. Try and keep at least 3 hours gap between your meal and sleeping time, and you should be fine. And incorporate some exercise.
Right. We have a question from K. Surinayan, who says, I'm having a problem that even though I eat less, I feel my stomach is full. At times, the food I eat would come to my throat and also have a burning chest sensation at the chest. At present, I'm taking Rabiside tab 20 daily twice as prescribed by my family doctor.
Yeah, I think just continue with this. In case if it still persists, then again, you'll need to get an endoscopy done. As I've said for the previous, what you need to look out for. And that's about it. Most important, again, lifestyle. See what you're eating. What are the refluxes? Refluxes can be coffee, can be garlic, onion, mint, cheese, chocolates. These are all refluxer foods. Avoid large voluminous meals. Have small meals. Have small portions. They are very important. So look at your diet, because our diets are so varied. We are a multilinguistic uh, country, multicultural country. So therefore, all the cultures, diet, habits are all variable. Garam masalas which some might tolerate, some might not tolerate. So you have to keep a watch on this. So again, make sure your diet is looked at, and keep in mind that oh, I had acidity last night. What did you have? You had a pizza. So tomato can be one of the things, and cheese can be one of the things. Next time, have cheese without tomato. If you don't get reflux, you're okay with cheese. Then go back and have tomato. Have a tomato soup, or again have your pizza. And if you get reflux, it's probably a tomato. So that way you need to eliminate in your diet from day to day and make a list of them, and then therefore you yourself incorporate your diet. There are many nutritionists in the city who are very good, and I'm sure somebody close by to you can help you eliminate and create a good diet for you. This is an important message again to everybody who is listening to us.
Thank you. We have a question from KB Mahajan, who says, I'm male, 80 years. I was having bloating after lunch despite the fact that I was taking antacid in the morning. I underwent endoscopy and was told that I'm having hiatus hernia. Can this be cured? I do not lie down for about 90 minutes after lunch. Is it enough?
Now, it depends upon what grade of a hiatus hernia you have. Is it a very large hiatus? Is it a very small hiatus? If it's a small hiatus, again, lifestyle changes, avoid putting on weight, all right, and continue with these medications. That just should be fine.
We have a question from Shakil Ansari, who says, I'm facing on and off cough and throat irritation. I also feel restlessness with mild cold sweat. I don't feel a degree of heartburn. I visited a GP, and after all diagnosis with blood tests, he said due to anxiety there's acid reflux and hence throat infection and mild cough. He gave me omeprazole for 7 days, which I took. However, this seems to be persistent and happened 2 times again. Can you please advise?
Shakil, you need to undergo an endoscopy. Let me just put it straight. You are refluxing, and we need to find out, because the reflux is now causing sore throat. We get to see a lot of patients who come with basically throat congestion. They take antibiotics, they get worse. It's because they're refluxing the acid. People sometimes come with asthma. They come wheezing because they're refluxing. Because whatever they're refluxing, there's minute uh, aspiration of acid which goes into the lungs, causes severe bronchospasm, and you just clear them of the reflux, and the asthma also gets cured. So that's another very important thing. There are two molecules which have been specific for reflux, that is rabeprazole and escoperazole. So in fact, if you're taking omeprazole, I would say you please change to one of these two molecules. Start with a twice a day dosing, see how you feel. If it still doesn't this thing, then I think you can come and meet me.
Uh, we have a question from Shefali Sethi, who says, can hernia be the reason for acidity and severe burping? My father-in-law is 80-year-old and has hernia.
Again, I want to know how bad is the hernia. Is it a slight hernia? Is it a small hernia, moderate, or a large hernia? If it's a small hernia, I think nothing to be really done. Just continue with the antacids. You might have to add what we call prokinetics, like a domperidone or something of that sort. And if he basically has a very specific condition called postprandial fullness. That means after eating, if you're getting full, then there is a new molecule called icosiamide, which can be used and it will give good relief.
Right, thank you. We have a question from Neerav Sangvi, who says, my name is Mahendra Sangvi. I'm 75 years old. I have a bitter mouth and heaviness in head after 2 or 3 hours of my dinner. Also, at times, I'm having difficulty in breathing while I'm sleeping. At times, my tongue and feet, toes are burning.
Okay, you need to tell me whether you're diabetic or not. That is important. And because in case if you are diabetic, what can happen is long-term diabetes can produce what you call gastroparesis. And so therefore there is a weakness in the stomach. The peristalsis or the pumping of the stomach becomes weak. And therefore you can have delayed gastric emptying time. And that can cause reflux. So you need to be put on a prokinetic and double dosing of your PPI. This person is 77, a diabetic, a heart patient for many years, and he's been having gas problems. Presently, I have a problem of burping from the mouth immediately after taking water, and he's basically a male. So if you're diabetic, as I just mentioned, you could be having, again, gastroparesis. You need to be put on a prokinetic. Well, because you're taking, you've not told me whether you're taking aspirin or a blood thinners or not, because with that also, all these problems of burning can occur. So you need to give me a little more history, then I can really help you out there. There's another anonymous 71-year-old with chronic acidity taking PAN 40 daily at night. Any harmful effects? No, there is no harmful effects of taking it. Any other alternatives? I would say eat your dinner early. There are other certain things also which can calm the stomach down. You know, if you've not told me whether you're diabetic or not diabetic, others, what I tell general people is sometimes ice cream and kulfi, they are also very good antacids and they're accepted a lot by people. So I tell them is you just thaw the ice cream or the kulfi, so it becomes, so it's not cold, it becomes it becomes room temperature, and you just have 5-6 teaspoons of it, and it really does the work well. So that's good enough. Or you can take an antacid along with you, and take an antacid with us alginate. Alginate is basically a specific compound which is like a dietary fiber. Now that, you know, kind of reacts with the acid, and it you know, traps some of the ions inside, and so therefore it forms a gel and it reduces acidity. So any antacid with alginate will do well. So you can try that definitely. There's another person, Mr. Subhash Singhal, 76-year-old male, taking rabeprazole and domperidone every day for a few years. Is there adverse effects? Is it possible to? That's all I've got. Now, there was a lot of talk about people taking antacids over long period of times and their harmful effects. What can happen is people can have loose motions, people can have pneumonias, people can have diarrheas, people can have Clostridium difficile infections. Though these are documented, they are not very common. So, you know, everything what is documented need not mean that I'm suffering from it. That's a very common thing. People read and think, oh, I'm suffering from this. I'm having a headache. Do I have an aneurysm? Because they just read something about an aneurysm. No, you don't have an aneurysm. So I think it's important that, you know, one has to just know, you know, the things. So you can continue with your rabeprazole and domperidone. Again, change your diet, eat small meals. That is very important.
Right.
There is another one which I've got from Shefali. Is it safe to continue having Pantosic DSR for a long period of time? For how long are you taking? I really don't know. But you can safely take it. You need to give me a little more of your history, then only I'll be able to know. Otherwise, it's difficult for me. Another one is asked me, can I take a glass of plain club soda every day? Well, soda is again beverage, is a fizzy drink. All these fizzy drinks can actually induce a lot of reflux. Now you're saying it is plain. So what typically must be happening is you're having club soda and then you're burping, and you get a good sense of satisfaction. It's a feel good factor. Doesn't really do much for acidity or anything, but hey, if it's working well for you, you can continue it, no problem.
Doctor, there's a question which has come in, which is in a sense similar. How safe, and I have to use the product name here, but how safe are products like Eno? Is it safe to use it, to consume it often enough?
it's again bicarbonate. So that kind of neutralizes the acids. So it is safe. But we have seen people taking for temporary relief. That is good. But on the long run, it's not good. People have again come back with a lot of reflux. So, it's like a 50-50. Can't really put my finger on it.
There's a question from Ganesh Gangude who asks, are there any predictive medical tests to detect the early symptoms of acidity or gases?
Any test to predict acidity or gases?
That's right.
There are no tests. There basically will be symptoms. And with the symptoms, we will test them and know whether it is acid or not. Well, if you are refluxing, then we can do what we call as a pH study to know how much of acid you are refluxing. And sometimes we can also measure whether you're refluxing bile or acid. So there are some tests of this which are available.
We have a question from Mr. C.S. Venkatesh. He's aged 72 years. He says, I'm having severe mouth burning syndrome since 3 months. Can't taste even a little spicy stuff. I'm pure vegetarian, no smoking, no alcohol. My mouth is clear, no boils, ulcers, no bad smell. Type 2 diabetic, but within normal range, maintaining. Please suggest some suitable medication.
No, so he's type 2 diabetic, you said. Am I right?
That's right, age 72.
Age 72. Again, I think he needs to see whether his glycosylated HB is absolutely fine. He needs to control his sugars if they are a little haywire. We need a good glycosylated HB. Again, diet, exercise, and the foods. Foods which he should avoid is he should be on a diabetic diet, which I'm sure he might be doing. Avoid rice and potatoes. That should be good. And he might require a prokinetic for the future.
Right. We have another question. Would appreciate some lifestyle tips and for management of heartburn, gas, and acidity as well. I know you've spoken about early meal and walk and some mobility. Is there anything else you would like to advise?
So in dietary control, one is you avoid taking those refluxes, which I told you is coffee, cheese, mint, uh, onion, garlic. These are all refluxes. Tomato can also be this thing. So get your diet in order. Exercise every day. If you exercise 45 minutes is good. Pranayama and Shavasana. These are two good asanas which basically calm your mind. Now, why am I talking of this? Why a medical doctor is talking about this? It's because there is something called as a brain-gut axis. Now, whatever signals are thrown by the brain, the gut will react. So these are the two asanas which kind of calm the brain down, calm the mind down. And so therefore, whatever signals are going through will become calm, and therefore your intestines also will become calm. The effects might not be immediate. They might take a little time, but you should do these two things. Important is a lot of people breathe through the mouth. So try and concentrate breathing through your nose. That's one. Two, people when they're drinking water, they gulp a lot of water from top. Try and use a straw. So you'll avoid swallowing too much of water. Three, do not eat fast. We are all in a fast-paced life. Mumbai is a fast-paced city. We are all running somewhere or the other. We all are trying to catch because we're getting delayed, catch our meetings, catch our train. We eat fast. When you eat fast, you swallow a lot of air. So please remember, enjoy your plate, what you're doing. Concentrate on what you're eating. Eat slowly, chew slowly. Those are the very important things which one has to adhere to. Take off your phone because half the time you're multitasking and eating. We eat fast. So avoid doing all these things. These are, again, in broad terms, lifestyle changes.
So Shiv Shankar Joshi asks, which are the food items that enhance alkalinity? And
so there are various ones. There are vegetables like, broccoli and green peas, string peas, spinach, coriander. Then you have oils like avocado, coconut oil, grains. You can have is millet, the quinoa. They are again good. Fruits like tomato, avocado, grapefruits, fresh coconut. These are all, a list of alkaline foods which are good. Tofu is again another common one people can eat. Then you can have, gluten-free breads. They are also good. So these are all various things. There are certain sprouts also one can eat. Nuts and seeds also one can eat. So these are all alkaline foods which one can have. Well, I have a question. Any exercise you suggest to address acidity? There's no exercise which can address acidity. Yeah, there are exercises which can prevent the reflux of acid, and that is, do not increase intra-abdominal pressure, avoid crunches, okay, avoid planks, anything which can increase intra-abdominal pressure, you need to avoid that.
We have a question from Mahalakshmi who says, without Rezo D, my acidity comes again. Uh,
Yeah, Mahalakshmi, I don't know for how long have you been taking it, but the thing is, sometimes when you stop the antacids, you can have rebound hyperacidity. So there's a certain way where you'll have to wean off your medication slowly, and then you might get good relief. There's another one I've just got a random one says I'm on Razo D, so I really don't know what that is. Another one, Nitin has said this: can gas cause pain around the rib cage? Can you take esomeprazole 20 on and off when there is acidity? I have these white spots on and off. Is it linked to acidity? White spots are not linked to acidity. You can take, it's called on-demand PPI. You can do that. So there is absolutely no problem. Does prolonged use of antibiotics cause GERD? Well, they don't cause GERD, but they cause acidity, and that acid can reflux up and cause a problem. So that is known. Another question is says that I have a headache. Is it associated with vomiting? And my headache is relieved after vomiting. I feel better. Well, it's very odd. I really cannot answer this question. Then another one is said, is Resium DSR good for gas problems? You can take plain Rabium, and if you still doesn't become round, then you can add a DSR component to it. We're having too many questions coming in.
yeah.
So
We have a question. Let me. Okay, we
yeah.
have a question from Devendra Gada who asks, "Do non-veg food does that cause acidity or vegetarian food?"
Well, it's not the food. Sometimes it's the masala, it's the marinade which people have. People put a lot of sauces and vinegar and all these things which come into the dressings. What I'm saying, dressings. Now they can cause I mean, they can cause a lot of acidity and they can cause reflux. So I won't really pinpoint it to food, but it's all to the masalas and all the salads and all the vinegars we put into the food which can cause a problem.
We have a question from Prayag Shelatkar, who's not mentioned his age, but he says, I have chest burning, and many times when I take food, especially rice, my food gets stuck in my chest and I'm not able to gulp it. I feel breathlessness. Gradually, it gets cleared after having water. What could be the reason?
Prayag, this is very important. You have to tell us whether you have any weight loss or no weight loss. Do you have any allergies? And what is your age? Because based on that, only one can tell you exactly, is it a serious problem or do you need to be investigated? But in my sense, because this being a seniors forum, I would assume that you are senior, and I would say you need to get investigated. Anything which people coming with food getting stuck in the chest needs to be needs to get investigated. So a plain simple upper GI endoscopy would give us a lot of answers. So you can definitely contact us and we can do the needful for you.
Uh, we have a question from Somesh Java, who is 66 years old, male. I'm an HOCM patient. I feel excessive gas in the stomach due to my genetic condition. I have difficulty in walking, exertion. When I feel excessive gas, it becomes all the more difficult to walk or any kind of exertion. Can I get rid of this gas problem?
So Somesh, I'm sorry to hear you're a patient of HOCM. It must be a very tough journey for you. But yes, gas. So you require a prokinetic. That's important. To look at the foodstuffs which you're eating, which could be producing gas. That's another thing. Do you pass good stools? Your bowel movements are regular, not regular. We need to see about that. And sometimes bad bacteria can produce a lot of gas. And do you have SIBO or you don't have SIBO? That's difficult to say. And accordingly, one can treat you with that. So I think just put yourself on some prokinetics and probiotics. Hopefully, you should start feeling a little better.
He says he is age 45 and not allergic to anything.
I think just prokinetics and probiotics and then see how you feel.
I'm going to apologize to people who have asked questions who are not above 60. So this is a question from Sadhna Dant, who says, I'm 62 years old, female, suffering from hiccups and burps intermittently from the last 6 years, even at night while sleeping, and suffering from high BP and too much bloating.
So Sadhana, one is I would want to know whether you again have diabetes or you don't have a diabetes. What you can do is you can take one night dose of a PPI. You can take an antacid at night and go to sleep. That should be much better. Look at your food. What food are you taking? How are you chewing? Sometimes please understand, Pradyuman, this is a very common thing. What happens is, elderlies, they have dentures. They don't chew food properly. Now, what happens is when the food is not chewed properly and just swallowed, these large chunks of food which are lying in the stomach, they go on to the colon, and in the colon they get fermented by bad bacteria which produces a lot of gas. So therefore it is very important, these are grinders, the teeth are grinders. You grind the food properly so that the digestion and absorption can occur better, and then excretion can become better. Because we don't chew properly, because we cannot chew properly, and especially in an elderly population, they have dentures, there can be problems with chewing. This is a common problem. So I would just say take one night dose of a PPI and see how you feel. If not, then we can come and help you.
We have a question from Mr. Rajendra Puttu, who says, I'm a 60-year-old retired person. I'm diabetic and have undergone angioplasty with 4 stents. Of late, I'm feeling a little pressure in the chest and get relief only after consuming warm water, which helps in releasing gas on burping. Please advise.
So you must be on blood thinners, I'm sure. You must be on ecosprin or clopidogrel or some medication which you're taking, and that can cause a lot of acidity. So you need to take a higher dose of antacids, and that should solve your problem.
Right.
This is an interesting question here. Can gallbladder stones cause acidity, reflux, or hyperacidity? Can removal of gallbladder reduce acidity? No, they're completely different, but they are very closely related. It's all got to do because of digestion and bile. Now, the gallbladder is usually on the right upper quadrant of your stomach, and your stomach and the organ stomach is right in the middle, is right, just below your rib cage, bone, the breast bone. It's right below that. That's what we call epigastrium, and right to that is called the right hypochondriac. That's where the gallbladder is. Now, if there's a lot of bile which is refluxing into the stomach, it can cause acidity and cause problems. Just by removing your gallbladder, your acidity might not settle down. We have a lot of our surgical colleagues, prior to removing of a gallbladder, they do subject their patients for an upper GI endoscopy. And as you know, I had mentioned an H. pylori infection. If they have an H. pylori infection, you get rid of the H. pylori infection and all the acidity goes away. And after removal of the gallbladder, they generally don't have a problem. So that is important to know. Though it is closely connected, they cannot be so well related as such. Yeah.
Since you mentioned H. pylori, there's a question from a 72-year-old male who suffered from bleed in the appendix twice and was hospitalized, but there was no diagnosis. He asks, could it be H. pylori?
Bleed in the appendix. So I really don't know what he means. Did he have internal bleeding in the intestines or appendix? Because appendix, if it bleeds, it's a surgical emergency. The surgeon will come, take it off, and you're done with it. The appendix does not regrow again. Please, people ask me, does the appendix regrow? No. The only organ which can actually regrow is our liver. So therefore, we tell our patients who give, donors, they are scared for liver transplant, cirrhotic patients. So we tell them we'll remove 3/4 of your liver and then the liver again grows back. So that has a regenerative property, but the appendix does not. Let me get back to you. If there is a bleed inside, you need to tell me whether you're bleeding inside. If it's H. pylori, yes. If you're having a duodenal ulcer and a duodenal ulcer bleed, then the H. pylori can cause this bleed. Otherwise, it cannot.
We have a long question from Mahendra Sangvi, who says, I'm 75 and I do not take any medicine except one tablet for blood pressure control. After dinner, in 2 or 3 hours, my mouth becomes bitter and my head becomes heavy. I cannot sleep properly as this state continues till morning. At times, I also find difficulty in breathing for a couple of hours. I'm facing this problem since the last 6 months. I feel good when I take local doctor medicine for a couple of days and again the same problem. I normally take dinner early and prefer to take light food and ensure that I keep 2 or 3 hours gap before I go to bed. Please, what should I do to solve my acidity problem? What exercises should I do and what should I not eat?
I think important is again avoid those refluxes which I told you. Have a 20-25 minute walking regime even in the evening. That will be good. Eat early, eat light, double your dose of PPI, and then see how you feel. That's about it. And if not, then you need to get investigated. Again, the 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 gold standard or the best modality to assess H. pylori, acidity related problems is an upper GI endoscopy. They're very good. Now, people have a lot of reflux, but when one does an endoscopy, is when you have alarm symptoms like difficulty in swallowing, difficulty in swallowing with weight loss, if there is vomiting of blood, if you have some unaccounted weight loss, um, these are alarm symptoms for us. So one has to be very, very careful. When you have these, you need an upper GI endoscopy. If you have black stools, and if you're not consuming oral iron tablets, then black stools means blood. Blood becomes black. And therefore, if you're passing black stools, means you've bled in the stomach or in the small intestine. You need to urgently see your doctor. So these are indications where one needs an upper GI endoscopy. I'm not talking about the other indications where people swallow marbles and pins and pens and all those by mistake. We've pulled a lot of things out from people's stomachs and intestines, but those are other indications. Pure acidity is, these are the indications for an upper GI endoscopy. So all the people who have these problems, they should look at getting your blood tests, getting a sonography, getting specific blood tests like for sugars, and getting your ECG monitor. Everything is normal, then you all can definitely plan for an upper GI endoscopy.
We have a question from Beena, Dr. Shah. Actually, this is from Arjun Chabria, who's age 73. It takes time for me to pass my bowels in the morning, and uh, and it takes time, and also immediately after meals, I get the urge to pass motions again. Also, I have a feeling of incomplete evacuation, which adds to discomfort in my stomach. My colonoscopy was absolutely clear. How do I get rid of this problem permanently?
So basically, you have a slow transit colon. That means it's taking time. So we'll have to give you a good dose of laxatives. If there is stress, take off the stress. Again, have a moderate amount of fiber with good liquid intake, and that should be the good thing. Now, in case if it still doesn't happen, you might need to do certain things like a transit study or a anorectal manometry.
Right. We'll take two more questions because questions are coming in, but these are from seniors and they have not been asked earlier. I'm 62 years old. This is from S. Aditya. I have alternate loose motions and constipation for days. Also, I need to pass motion at least twice in the morning till the stomach settles down.
Aditya, you have what we call as an irritable bowel syndrome. It looks like an IBS to me. Again, I said try and do something like yoga or some light reading to take off your stress, and look at your diet. It should settle down. This is not a major problem, alternating diarrhea and constipation. So that's not a worry at all.
Thank you, Dr. Shah. It was amazing. We had a really large attendance here, which is a good thing and a worry because obviously there are several people who are facing this problem. I'm going to end it with something that Nagaraj SR has said. So, in my opinion, hurry, worry, and curry are the main reasons for health issues in older people. Well said, Mr. Nagaraj. And
I can say we say hurry, worry, and curry leads to duodenal ulcer, but now we also add H. pylori to it. So hurry, worry, curry, and H. pylori. So you have to be careful. That's all I can say.
thank you very much, Dr. Prasanna Shah, for this
Thank you.
session, for addressing questions on acidity, gas, and heartburn.